John Clark with Sunshine Prosthetics here. This week's tips for physical therapists from prosthetists. This week might feel a little different because you might be like, what's this guy talking about A1C and blood sugar levels for? Well, I'll tell you. We're often asked when we tell people what we do, it's like, oh, so you work with veterans. Huh. Yes, we do. But that's not the real story. In fact, something fun that I learned recently is even among the veteran population, more veterans have lost their limbs due to peripheral vascular disease secondary to diabetes than in combat. So the normal pathway towards someone becoming an amputee is most often peripheral vascular disease secondary to diabetes. Now, blood glucose levels is the disease pathway that gets us there. And we're in a position where we're typically taking care of someone long term. You don't lose the need for a prosthesis, even if you get really good at walking. So we are in a relationship with our patients, and we do want to be paying attention to them and the disease pathways that led to their original amputation. We're going to keep our eyes on their healthy side. And part of what we like to do in our practice as part of that care is to be asking, hey, what is your? Now, just a little thing that I do with it, I like to struggle with it. Yes, I know it's A1C, but I'll just start, so tell me, how's your, what is it, that A1? I do that because the patients that are attentive to this and are on top of it, they'll interject. They'll help you out immediately because they know their number. They know how important it is. They're going to be happy to share it. But part of the reason why I do that is because you will get patients that don't know. Some of this comes about because, frankly, if you get excellent medical care, a lot of this stuff can be avoided. So if someone already has an amputation, sometimes that's a reflection of the fact that they don't have a great supporting healthcare team that's making a difference. So it's good for us to discover those patients that haven't keyed into this stuff yet. That way we can be sure to be directing them to their physicians, to paying attention to their labs, go over it with them, review how it's trending, see what they've been doing as far as, diet, exercise, their medications, to managing it, and to show them the connecting dots between what we see in their skin and their limb and their A1C levels. Every once in a while, we'll even get a patient that we need to direct them to a new primary care physician because they're just being ignored in this respect. And like us, you generally don't have a patient for life, but you do have more patient interaction frequently than the patient's physician does. So we really encourage you to make it part of your regular practice to be asking about and seeing how interested, involved your patient is in knowing and understanding this important blood glucose marker. So my prayer is that you'll think about and care about this little aspect with your patients, that you'll start to ask, or maybe just struggle through asking, hey, how's your A? And that you can find some folks that need some intervention there and get them going in the right direction. Wish you well.